It's time like these when I miss the unconditional love and support of my beloved pugs, Dash and Jack Jack. As you may have guessed, that my children named them when they were small after a movie, The Incredibles. Well, they passed several years ago, but the grief still surfaces when the world feels heavy. It feels like we all need emotional support animals right now. The murder of Alex Preti, our 37-year-old ICU nurse in Minneapolis VA hospital, who was shot and killed by federal agents while holding his phone and helping a woman. Then there's the 46,000 nurses, perhaps more as of the time you hear this, that are striking across the country. 96% of nurses have one or more symptom of PTSD. Nearly 1 in 4 nurses meet the diagnostic criteria. Nearly 1 in 4 nurses meet the diagnostic criteria for PTSD. It's a lot for any one person, any one nervous system to manage. Last week, I told you about the 4 forces converging on nursing: the staffing crisis being stretched to the breaking point, the sickness, and the suffering. Well, this week I'm going to tell you why the system is weaponizing these forces against you and what they're most afraid of, and that is your nervous system regulation. Let's get into it. Nurses are walking out in unprecedented numbers. They are saying enough. Approximately 31,000 nurses and healthcare workers at Kaiser Permanente walked off the job recently. For months, they have been at the bargaining table, fighting for safe staffing levels, fair wages, and to stop the cuts. Kaiser keeps slashing health benefits and retirement benefits. They are denying active medical coverage and pension benefits. They're also targeting newly organized groups, including nurse midwives, physician assistants, and CRNAs. This is Kaiser's second major strike in 4 months. Meanwhile, in New York City, 15,000 nurses have been on strike for weeks at Mount Sinai, Montefiore, New York Presbyterian. This is the largest nursing strike in New York City history. They're trying to slash healthcare coverage for 44,000 nurses statewide. Montefiore blocked striking nurses from accessing their medications at a hospital pharmacy, allegedly. Think about this for a minute. Nurses who are striking for safe staffing ratios so they can provide better patient care are being denied access to their own health and medication care. In Michigan, nurses at Henry Ford Genesys Hospital have been striking since September 1st, over 160 days as the time of this recording and counting. That's over 5 months fighting for enforceable and safe staffing ratios. With wind chill factor accounted for, these brave and determined nurses are striking in sub-zero temperatures. This is how important these issues are for nurses and their patients. And these are forces, number 1 and 2, playing out. The staffing shortage, hemorrhaging nurses from the profession, and nurses being stretched beyond human capacity. Then we come into force 3, the sickness. Hospitals are weaponizing this force. Hospitals are cutting health care for the people who provide the health care. It rings oxymoron in my logical brain. Let's talk about the data. Compared to the general population, nurses face 121% higher hospitalization risk for infectious diseases. Half of all nurses have been physically or verbally assaulted by a patient or family member in the past 2 years. Healthcare accounts for almost 73% of all workplace violence injuries that require time away from work, according to the U.S. Bureau of Labor Statistics, with data from 2021 and 2022. 77% of you are experiencing musculoskeletal injuries each year. And as I said earlier, 96% of us have one or more PTSD symptom, with nearly 25 or 1 in 4 meeting the full diagnostic criteria for PTSD. This is according to a Journal of Clinical Nursing Integrative Review by Schuster and Dwyer. These are scientific facts, and they want to expose you, but refuse to pay for your care when you get sick. And this brings us to the 4th force, the suffering, because violence is escalating. On January 1st, a deeply constable attacked 3 nurses at Houston Methodist Baytown Hospital. One of the nurses was 26 weeks pregnant. She was struck in the head twice with a printer and then had a computer monitor slammed into her back. On January 24th, Alex Preti, a 37-year-old ICU nurse at Minneapolis Veterans Hospital, was shot and killed by federal agents. He wasn't carrying a weapon. He was carrying a phone. And his family is understandably outraged at the administration claiming sickening lies. In 2023 alone, over 23,000 assaults on nursing personnel were reported, according to the Press Ganey ND-NQI data. That's up 64% from 2019. Physical assaults were the most common type, with psychiatric units and emergency departments leading those numbers. I wonder how many more are happening today. How many are suffering in silence without the knowledge, the resource, or the support they need to process everything that they've endured? Now, before I go on to the next part about what they're hiding, let's just take a quick pause, because I have mentioned several times that we have nervous system regulation practices and we also have free resources. The first step that you can take today is to go to drlorrelaws.com/assessment. There you will find a free 2-minute nurse trauma assessment where you can learn how you are being affected by nurse-specific trauma. You'll also be linked to a resource vault and weekly live calls with me. So you can go to drlorrelaws.com/assessment and check out my entire website. Free resources for you. Now, let's talk about what they're hiding, because time feels a little unstable. It feels like there's nothing we can do, but there is. I am staying the course on one of the biggest discoveries of the decade that no one is talking about. It's that burnout isn't really burnout. Burnout is a symptom cluster. It's not the root cause. The root cause of what nurses are experiencing worldwide, that's nurse-specific trauma. I wrote about this in the Global Gaslighting Network issue, which you can find on my website or on any of the traditional newsletter outlets, and why healthcare systems need nurses subordinate and compliant. I've also written about why no one is teaching nurses the nervous system science that they need to stay safe and regulated. Now, let me tell you why they keep this evidence out of nursing curricula and continuing education. In fact, this is such a huge gap that I recently retired from my professor role as an integrative nursing professor, because we aren't teaching students the science that they need to be safe and regulated in their nervous system and have their mitochondria protected from oxidative stress and metabolic rigidity. So let's talk about why they're doing that. Allegedly, they need you in survival mode. For healthcare systems to keep you compliant, you have to be in survival mode. Sympathetic overdrive, the fight response, the flight response, fawn response, or freeze response. It doesn't matter which of these responses you're in. They just want to make sure that you're in one of them. And for most nurses, we stay in those states, even when we're away from work. Why? To block the ventral vagal tone. That is where our nervous system, the human nervous system, autonomic nervous system, how it's kept us alive over the millennia. So this is where you get the big picture. When we're in ventral vagal tone, we're grounded, we're centered, we're curious, we can see the big picture, we can connect and socially engage, we can collectively advocate. Our clinical judgment and reasoning are at their peak. This is where our judgment and discernment are optimal. So when you are regulated and thriving in your window of tolerance, you're capable of being and doing whatever you choose. Now, that's a massive threat to systems that marginalize, overwork, and disenfranchise you. Your nervous system is the resistance. Your nervous system regulation, it is the resistance. When you learn to regulate your nervous system, trauma exposures just roll past you. You stay minimally affected because you're not in survival mode. When 5 million nurses get regulated and can work together towards shared goals, well, we become unstoppable. Harnessing the innate capacity and power of the midbrain, the limbic system, the vagus nerve, the autonomic nervous system. This is how humans have survived the millennia. Regulation in our nervous system enables social connection and collective action. So I wonder, I have been pondering, and I'm inviting you to do the same. What could 5 million regulated nurses do? So let's just give that some thought. Take a couple of breaths with me. Imagine what your life would be like if you stayed grounded, centered, regulated, heart-centered, curious, in your best nervous system state. What would your day be like? Your week, your career? Imagine that for 5 million of us. We could work together. we could usher in the new era of nursing that I have been writing about for over 7 years, called Nursing 2.0, the Nurse Safety and Professional Wellbeing Edition. We can mandate it. We can require that, but only if we work together. And your nervous system exhaling out of survival mode and into regulation is the first step. Imagine what it would be like to have robust resources to help you process and integrate the traumas that you're exposed to and experience. And what if the system took accountability for the avoidable nurse-specific trauma exposures? I mean, I can almost feel your jaw tension releasing and your shoulders dropping, and I'm feeling the same. Nurses, what would it be like if we were harmoniously working together instead of tearing each other down? We don't want to tear each other down. We have been pit against one another and constantly traumatized and dysregulated so that we cannot come together. But in each of our healers' heart, that's exactly what we want. We want to be together as a global profession where everyone is safely staffed, adequately resourced, regulated, and safe in their nervous systems and in their physical and emotional safety. Imagine how empowered you would be. And then imagine how profoundly the system would need you if you didn't need it. People come to hospitals for one reason: nursing care. Yes, there's outpatient services, but the reason people stay in hospitals is because they need nursing care. Your patients' outcomes and your colleagues' well-being create a positive feedback loop for everyone. And this is what terrifies them. Your regulation in your nervous system is the resistance. It is the path forward. This is where you lean in, beyond doom scrolling, beyond thoughts, prayers, and feeling helpless. The evidence-based 5-step trauma healing process from my research is available for free for anyone. And I'll quickly outline those steps. The first step, you're already aware because you're here. You identified the correct root cause. It's not burnout, it's nurse-specific trauma. Then you can go right to step 2. And if you haven't done so already, you can go to my website at drlorrelaws.com/assessment and take that free 2-minute nurse trauma symptom assessment and find out how you are being affected in all your health domains. That brings us to step 3, where you start creating your recovery blueprint with the nervous system practices and support you need for every state, every circuit, every hybrid that your nervous system occupies. You will have tools and resources to support that. The breakthrough happens at step 4 when you master your window of tolerance. When you master your window of tolerance and stay regulated in your nervous system, independent of any external factors at work. This is where your nervous system regulation becomes your biggest asset. When the system cannot hijack your nervous system into dysregulation any longer. It cannot throw you in survival mode. It cannot keep you disempowered. And then finally, the last step is that once you attain that proficiency and mastery in your window of tolerance and nervous system regulation, then you're ready to lead. You're ready to expand in your healing gains and have them ripple out to all areas of your life. And you can ascend in your spiritual, relational, emotional growth. You can live your highest and best life as you define it. So we can start with unit changes, then organizational changes, and then system changes. But what we need to do first and foremost is gain mastery over the nurse trauma exposures, many of which are avoidable, and our nervous system regulation. Then we cannot be silenced. We cannot be stopped. We'll be regulated, reconnected, and ushering in Nursing 2.0 that prioritizes nurse safety and professional well-being that directly contributes to optimal patient outcomes. This is the single most important factor that we can do for ourselves and for our patients. When you regulate your nervous system, you reclaim your power. And when 5 million regulated nurses work together collectively, we dismantle the systems that are designed to break us. So, as we wind down this episode, please know I want to hear from you. Are you not sure where to start? Is it a dumpster fire at work? Are you exhausted and couch rotting on your days away from work? Not because you're lazy, but because your mitochondria literally cannot produce the energy that you need due to this nervous system dysregulation? Well, send me a DM on any social media outlet or send me an email at team@drlorrelaws.com. I personally read and respond to each and every message, and I will help you however I can. I'll send you the resources and practices that I use when everything around me is chaos. So if this episode resonates with you, please do share it with someone who needs to hear that their regulation is not self-care. It is the resistance. From my healer's heart to yours. And until next time, namaste. You might be wondering, do I really have nurse-specific trauma? Or perhaps could it be that it's just burnout? Well, there's only one way to find out, and that is to take the free nurse trauma assessment. You can do that right now at drlorrelaws.com/assessment. It takes under 2 minutes, and I will send you a tailored report with guidance as to where you are on the nurse trauma spectrum, and importantly, what steps you can take next.